Tauroven. Tauroven containing taurolidine is a broad-spectrum antimicrobial and also have anti-lipopolysaccharide properties. Tauroven is a unique anti-infective for surgical infections, for use in the local management of standard supportive, surgical, or peritoneal lavage after dilution or solution for installation. Tauroven is a unique catheter lock solution for hemodialysis, peritoneal dialysis, ICU, oncology, parental nutrition, and other similar conditions. Tauroven is a life-saving antimicrobial for severe sepsis, such as abdominal sepsis, urinary tract infections, septicemia, peritonitis, lung infections, and other infections. Bacterial resistance against Tauroven has never been observed and is unlikely to occur because of its unique mechanism of action. Tauroven have broad antimicrobial, bactericidal, antifungal spectrum, and also fight against biofilm. Tauroven have favorable safety profile aspects. With no adverse effect, Tauroven acts by a non-selective chemical reaction. The active principal molecule of taurolidine are methyl derivatives of tauroltam and taurinamide, which react with the bacterial cell wall as well as with the primary amino groups of endotoxins and exotoxins. Microbes are killed and the resulting toxins are inactivated. Tauroven has antitoxin activity. It neutralizes the exotoxins and endotoxins, so no Hexheimer reaction will take place, and no endotoxic shock condition arises. Tauroven has anti-adherence properties. Due to this, it also prevents the biofilm formation. Within 24 hours after the insertion of catheter, it becomes coated with biofilm. Taurolidine destroys the biofilm by killing the bacteria. The parent molecule taurolidine destroys biofilm by killing the bacteria and inactivating the endotoxins and exotoxins, and itself gets converted into taurine, an aminosulfonic acid, carbon dioxide and water. Due to accumulation of bacteria community on a common solid surface, biofilm will form. Biofilm consists of polysaccharide, fibrins, laminin, and is formed by both microorganism and endogenous substances. Bacteria can reach the bloodstream through various modes and start forming their colonies, that is, biofilm, and they become resistant to antibiotics within the biofilm. After 15 to 30 minutes of Tauroven installation in catheter lumen, Tauroven destroys almost 100% of the bacteria, and the biofilm is reduced up to 70%, plus minimizing the infections related to microorganism. Virulent bacteria produce toxins and leads to sepsis conditions. In biofilm, bacteria protect themselves from antibiotics by secreting extracellular polymeric matrix layer around them. Tauroven is a novel antimicrobial to treat and prevent severe infections and sepsis conditions, and thus Tauroven inhibits the virulence of bacteria. Tauroven is also effective against the already formed biofilm, as it also dissolves the extracellular polymeric matrix substance, ECP, secreted by microorganisms. Tauroven react with the glycans and peptide part of extracellular polymeric layer and dissolve them, and also kill the bacteria in biofilm, and neutralizes the endotoxins and exotoxins. Tauroven has broad spectrum of action. Tauroven is active against a wide range of microorganisms that include gram-positive bacteria, gram-negative bacteria, fungi, endotoxins, mycobacterium. Tauroven is also effective against bacteria that are resistant to various antibiotics or multi-drug-resistant organism known as superbugs such as MRSA, methicillin-resistant Staphylococcus aureus, VRE, vancomycin-resistant Enterococci, Visa, vancomycin intermediate Staphylococcus aureus, VRSA, vancomycin-resistant Staphylococcus aureus, Orsa, oxacillin-resistant Staphylococcus aureus. Antimicrobial spectrum of Tauroven include various gram-positive bacteria, gram-negative bacteria, mycobacteria, and various species of fungi. Gram-negative bacteria: Klebsiella, Enterobacter, Citrobacter, Proteus, Morganella, Acinetobacter, Pseudomonas, Shigella, Salmonella, Serratia, E. coli, etc. Gram-positive bacteria: Staphylococcus, Enterococcus, Streptococcus, Listeria, Leuconostoc, Pediococcus, Clostridium, Corynebacterium, Peptococcus, Peptostreptococcus, etc. Fungi species: Candida, Aspergillus, Rhodotrula, Rhizopus, Cryptococcus, Trichophyton, Epidermophyton, Mucor species, etc. Tauroven is indicated as catheter lock solution, anti-infective for surgical infections, life-saving antimicrobial for severe sepsis. As catheter lock solution for hemodialysis, peritoneal dialysis, ICU, oncology, parenteral nutrition, and other similar conditions. Locking of catheter is important process in maintenance and protection of patient vascular access session or system. There are 4 basic procedures that are used for the maintenance of central line and other catheter-related conditions. These procedures are: preparation for the vascular access session, aspiration of the lock solution from the central line lumen, flushing the central line lumen before and after the vascular access session, locking the central line lumen until the next vascular access session. Please be aware that some procedures and products may vary depending on the type of central line and catheter in use. Always consult your institution policy and procedure for the appropriate method to use for the catheter management and disposal of materials after use. Preparation of vascular access session. Gather all the supplies required to perform the procedure. Wash hands thoroughly, making certainty between fingers and under nails. Dry hands with a clear towel. Place the supplies on a sterile field. Put on a pair of sterile gloves. Access the patient insertion site for signs of inflammation or injection, and central line or other catheters for problems such as cracks or line migration. Aseptically scrub the hub for a min of 15 seconds to disinfect the insertion site. Allow the hub to dry for at least 30 seconds. Aspiration of the lock solution from the central line lumen. Some procedures required that the previously instilled lock solution be removed by aspiration before flushing the central line or other catheters. Attach a sterile anti-syringe of the appropriate size to the central line hub. Open the clamp on the central line, aspirate into the syringe to remove the lock solution, and to confirm blood return, close the clamp on the central line, remove the syringe. Flushing the central line lumen before and after the vascular access session. Some procedures required that the central line be flushed with a normal saline solution prior to and after the vascular access session. Depending on the protocol, flush the central line lumen with 10 or 20 milliliters normal saline containing 0.9% sodium chloride solution. Connect the syringe to the central line hub, open the clamp, and flush the central line lumen with normal saline. For maintaining positive pressure on, close the clamp. Remove the syringe. Repeat the aspiration and flush procedure for each central line lumen. Proceed with the vascular access session, and at the end of vascular access session, flush the central line lumen with the normal saline as previously described. Locking the central line lumen with Tauroven until the next vascular access session. Locking the catheter lumen is the last step that is undertaken at the end of vascular access session. This step is performed in order to maintain and protect the patient vascular access session, and to prevent infection related to microorganism. Take out Tauroven with the help of syringe from ampule. Connect the syringe to the catheter hub. Open the clamp. Slowly over a period of 8 to 10 seconds time period instill the Tauroven solution into the lumen of catheter. Maintain a positive pressure on syringe piston. And close the clamp. Remove the syringe and repeat procedure for each lumen of central line. As anti-infective in surgical infections, for use in the local management of standard supportive, surgical, or peritoneal lavage, and for irrigation after dilution. Cleaning is the key step for wound healing. No wound can heal properly unless it is clean, healthy and free from infections. 0.5% taurolidine solution should be used to treat and prevent microbial contamination in open wounds. Wounds should be washed thoroughly with Tauroven solution to treat or to prevent infections caused by microorganism. Proper cleaning of wounds with Tauroven leads to healthy condition of patients. As anti-infective in surgical infections, a solution for installation inside the body cavities to treat various fatal conditions caused by microorganism. A catheter is inserted in the cavity, and through this 0.5% taurolidine solution should be instilled inside the body cavity, and should be remain there for at least 2 hours. And after that discard the solution from cavities, and repeat the procedure, as per the severity of conditions for further days. As a life-saving antimicrobial for severe sepsis, septicemia, abdominal sepsis, peritonitis, lung infection, urinary tract infection, and other septic conditions. To treat sepsis conditions, Tauroven solution should be introduced intravenously to treat diseased condition raised by microorganism. No more infections with Tauroven. Tauroven helps in complete critical care. In and out. Tauroven was approved, recommended and included in various protocols and guidelines as a broad-spectrum antimicrobial and anti-lipopolysaccharide. Together we can fight against superbug with the usage of Tauroven. Pathogen-free life with Tauroven. Briogen Pharmaceuticals Private Limited. We care for your health.